What I'd like you to do is, you can go ahead and then bring your knee to your chest. Great, and back down. Any problems with that? Okay. So that's my full range of motion before I start the manual muscle test. Okay? Now, for the Illiopsoas, we're going to put her in slight flexion, slight abduction, and slight lateral rotation. Okay? But you see I don't have her flexed super much. Okay? So this is a position I'm going to want you to get into. So go ahead and do that for me. Good. So I don't want to put her in the test position because this is an active test. All right? Now I want you to hold it there and don't let me push it down. And relax. So we have a huge advantage because we've got a really super long lever arm. So make sure that you remember that when you do the test. Okay? So you had a 5 out of 5. Yay. Now, we are going to do the tensor fasciae latae in the same position. We've already tested full range of motion because we've already had her flex. This time, though, we're going to have her slightly adducted, slightly medially rotated, and flexed. So now this time you're going to put your leg in that position. Okay? And come on back down. Now, for the TFL, I'm actually going to just resist flexion. Okay? Where the other one, I was resisting the adduction just a little bit. Abduction. So go ahead and come up for me. Good. And hold it there. Now, we'll finish the test before I start talking. Okay, so her TFL is just a little bit weaker. Am I doing these backwards?
No, I thought they were still abducted a little for
TFL is, yeah, I mean, you want to shorten it, and I'm lengthening it. So that's why it didn't make sense to me. Or is that what you're just supposed to say?
No. Well, I was just going to say something about the pressure. It does say flexion and abduction.
For TFL? Okay. So TFL is a lateral muscle. So do I have them completely backwards? No, you flip the slide. Yeah. Okay. So it doesn't make sense that they would be adducted, right? Yeah. Because that would be lengthening a one joint muscle. So that's why as soon as I said it, I'm like, wait a minute, that can't be right. Right? So the difference is going to be the rotation of the leg. Okay? So for TFL, we're going to be here with it twisted in, come on up, hold it there. Now, what I was going to say before is I'm putting pressure across her knee, and for some people that may not be good. So you may have to put the pressure above the knee, or you can do both, right? No, just relax. Okay, so you do want to be watching what's happening at the knee. Okay? Sartorius, of course. Old fogies like me used to do sartorius, yeah, where you would have people do you would have them slide their heel up along here. EMG analysis has shown that that actually is not a sartorius test. That's a hip adductor test. So you'll still see people do that in the clinic, but you're not actually testing sartorius. Now, in all honesty, the sartorius is not a muscle that typically is strained a whole lot. Okay, so this time, what I'm going to have you put your leg in a frog leg position, so out like that. Okay, and there you go. Any problems with that? Okay, so come on back down. Now this next time, I'm going to have you pull your leg up in that same position, and I'm going to try to push it down, and I'm going to try to push it out at your ankle. Okay, so what I want you to do is once you get your leg up there, I want you to hold it in that position. Okay, so come on up for me. Good. Are you ready? And relax. Okay, so I'm resisting the flexion, and I'm resisting the lateral rotation. All right? Okay, so I'm going to have you sit up on the edge of the table for me. So the medial and lateral rotators of the hip, I told you we test in seated position, and we test these muscles as a group. And so I think it says medial rotators first, okay? So what I want you to do is, this one you really do need to have. Oh, that poses a problem.
She's too short.
There you go. Okay. So what I'm going to have you do is bring your ankle out, keeping your leg there. Yeah, good. Okay, so I'm going to stabilize here. I'm going to have you bring your foot out. And I want you to hold it there, don't let me push it in, okay? Now I'm monitoring here to see if she's recruiting her hip flexors at all. She's also recruiting her quad just a little bit. And relax. So it was a 5. So now I want you to go ahead and bring your foot in.
Well, the garbage can's in there.
Oh yeah, that's hold it there.
I expect you to fix the problem.
And relax. Okay, so we're going to test the medial lateral rotators with the person in sitting.
Can she brace herself with the table?
No. Yeah, so that's a great question. They do need to have their hands up. That would be one thing you'd want to be looking for. Okay, that'll be another common cheat for quads as well. Off the table.
You don't have to
Just
brace
up.
in the air.
Yeah, right. That'd be kind of fun to see what you can actually get a patient to do. Okay, so we've gone through psoas, we've gone through tensor fasciae latae, we did sartorius, and then medial and lateral rotators. Why don't we stop there because the AD ductors and AB ductors will do in sideline. So why don't you do those tests?